Hey everybody, this is Dr. Murray from Monmouth Pain Rehab. I got Dr. Mike here. We want to show you a little bit about adjusting the mid-back and cervical in this positioning. A lot of times when you get adjusted, we adjust the mid-back this way or face up, and a lot of times the cervicals are done face up. So I'm going to show you a little bit different style of doing that, and you're going to hear a lot of sounds out of Dr. Mike. So he's not broken. Like I said, we're going to do this right quick. All right, so in the lumbar spine, we have this transitional area where the low back and the thoracic spine kind of come together, and this is a very difficult junction to get adjusted. So what I like to do is, first I feel around to see if there's any muscle tonality difference. And what I have is more tightness over here on that right side. So I set myself up where I'm putting a little bit more pressure on that right side versus the left side. And I just kind of feel for that patient's breath, and then I make that adjustment. And we got a nice adjustment. You see his legs move a little bit. That's normal for these type of adjustments. He's not hurting, but you do, like I said, you do see that motion going about. So now we're gonna move up. And as I'm working along here, I'm feeling the tonality of each muscle. I'm making sure I can see where that fixation of the joint is, and that's how I set up my contact point. So again, here, a little bit higher up from where we were down here before. We have some fixation in this area. We know that joint's not moving properly. Now, when we have these joints that aren't moving properly, that changes how our bodies are actually getting information from the brain into our organs, into our muscles, cells, and all that. So that's what we're addressing. We're addressing the change in nerve flow through the body by removing the subluxation or misalignment that patient is having. So that's what we're doing here. We found another area a little bit higher, and we adjusted that. So now for the neck, a lot of times you see patients getting adjusted while they're lying on their back for the neck. I like to do it while the patient is lying face down. I feel it's a little bit more comfortable for the patient, reduces some of the anxiety of that twisting of the neck and making them feel uncomfortable. So with Dr. Mike, what I do is I take and contact right here along that joint, checking to see which joint is fixated. I find that spot, and then I gently rotate the patient's head. Dr. Mike, you feeling okay? Mm-hmm. Good. And I impulse. That is a lot more comfortable for some of the patients that suffer from high anxiety to do that adjustment this way. It gets a nice movement, it's very fluid, and they feel great after the adjustment. Once again, we're adjusting these segments to reduce that restriction, improve nerve flow, and bring them back to health. So once again, we adjusted that segment that way. Now we feel to make sure we get a nice loose muscle tonality in there, and it's not still restricted like it was before. All right, Dr. Mike, come on up and tell me how that feels.
That felt awesome.
All right. So if you're experiencing any of this type of discomfort in the mid-back region or the cervical spine region, don't hesitate to come in. We're here. We're glad to take care of you. Thank you, and have a great day.